Well, the first thing to say about the topic of eating disorders in children is that eating disorders are actually a group of diagnoses that affect adolescents, children in general, quite frequently, so that actually the average onset of an eating disorder like anorexia nervosa, for example, is around the time of puberty, or maybe 3-4 years after the onset of puberty, so in the mid-teens and the later teens. So when we talk about eating disorders in children, it's sort of like we're talking about eating disorders. But eating disorders, it does surprise some people to hear that they can affect children even younger than teens. So children at the age of 12, 10, even sometimes younger, we will see with presenting to eating disorders clinics with eating disorder problems and in need of help. There is some good news about eating disorders in children, which is that if you can recognize it early, there's a relatively good prognosis for recovery or the person sort of turning around the eating problem. And that is often particularly the case if the child and the family can work together with an experienced professional to help the child re-engage in proper feeding and eating behaviors. Children, of course, present special types of problems, especially younger children, in terms of trying to figure out whether an eating problem is going on. So a child is not going to be able to describe their emotional world in the same type of abstract way that an older adolescent or adult is going to be able to talk about their internal world. So there may be more sort of figuring out cues that you see in children, to figure out whether an eating problem is going on. So maybe a child's coming home from school and they're bringing back their lunch and it's not eaten on most days. Maybe that tells you something is going on. Weight loss, of course, if it seems to be progressing. And in particular with children, while there can be weight fluctuations, if you go to the pediatrician and the pediatrician says, oh, your child has fallen off the growth curve, that could be an indication, that something is going on. Clearly in children, you also always have to rule out, like with adults too, that there's not a medical problem that's contributing to the weight loss that better explains the eating problem. But the good news again is that with early intervention in these eating problems in children, there can be a relatively good prognosis. So again, like with all eating problems in children and adults, early intervention and treatment is critical.